Hi, everyone. We'll be getting underway very shortly. Just stay tuned for a moment, please. Okay, welcome everyone. Great to have such a wonderful turnout to today's event. Very pleased that you can all join us for today's presentation called COVID-19 Vaccine and You. My name is Brittany Cadence. I'm the Communications Manager here at Peterborough Public Health, and I will be introducing Dr. Salvatierra here in just a moment. If I could just ask that you make sure your cameras and your mics are muted so that everybody can see and hear this. Thank you very much. So first, I'd like to, for us to take a moment as we gather here today to honor the beautiful land that we are fortunate enough to call home. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville Island, Rama, Beau Soleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. There we go. So before I hand it over to Dr. Salvatierra, I would just like to review a few things as we navigate this online forum. Consider me like your flight attendant, asking you to look at the safety card so that we all get to the end safely. For this journey, I would just like to note that the information will be specific to residents of Peterborough City and County and Hiawatha and Curve Lake First Nations. That we did receive many questions during the registration process, and Dr. Salvatierra will be touching on most of these during her presentation. These questions will be posted on Peterborough Public Health's webpage on the FAQ section, vaccine section. We'll also post this slide deck after, so please know that you'll have those resources available to you after this presentation. Now, if you are having any technical difficulties, please go over to the Peterborough Public Health YouTube channel. And as we're hosting this event using the platform MS Teams, and we've had such an incredible uptake that we're a little concerned that it might cause some instability and we might need to move everybody over to the YouTube stream, but it will be live and some of you are already on that stream. So if this does crash for some reason, all you need to do is go to YouTube and then just type in Ptbohealth and then you'll find our YouTube channel and it will be live streaming and Dr. Salvatierra will continue her presentation from there. Also that just please take note, this presentation is being recorded and that the recording of this webinar will be available on that same YouTube channel for Peterborough Public Health after the event. So please, as I mentioned before, make sure your mics and your cameras are muted for the presentation. And if there is time for more questions at the end, we'll be taking those from the chat box. So there won't be time for verbal questions, but we are encouraging written questions in the chat box, and I will be reading those out as we have time for Dr. Salvatierra to answer. So, and if you could please hold those questions till the end, and then we will start going through them. And any that we don't get to that are written out, we will make sure to include in our FAQ on our webpage. So with that, I am going to hand it over to our Medical Officer of Health, Dr. Rosanna Salvatierra, and give her a chance to share with us the latest on the COVID-19 vaccine. Go ahead, Dr. Salvatierra.
Thanks, Brittany, and hi, everybody. I'm just going to turn my camera on for a short moment just to say hello. I really enjoyed seeing some of your faces just before we got started. It's great to be with you today. And thanks so much for joining in. I hope you will find this to be a useful, a good use of your time, and we'll do our best to answer your questions. And as Brittany said, there is opportunity for more. So this is the first of many ways that we will be engaging and learning more about the vaccines as more vaccines become available in the next weeks and months. So get started. What I'm going to do today is I'm going to start with what we still don't know yet about COVID and the vaccines, just so that you know that if you have a question and it's something that we don't know yet, there won't necessarily be an answer today, but that we are working on this. And then I'm going to go through what we do know about the two that are currently available in Canada right now. So both Pfizer vaccine, Moderna vaccine are both what we call messenger RNA vaccines. So they work the same way, and so that's what the focus of the presentation will be on today, is messenger RNAs. As more vaccines become licensed in Canada, we'll do more education on those as well. And I will also, of course, touch or go quite, I think, give you as much detail as I know at this point on potential side effects, certainly on the safety aspects of the vaccines. But I do want you to be reassured that the authorization process for vaccines has not been shortened. There are no shortcuts. Canada is following all of the necessary steps. There's been thorough independent review of the vaccines to make sure that what we have in Canada are as safe as can be. And an example of that is that usually a vaccine requires a trial in about 6,000 people in order for it to get approved. Both of these trials for Moderna and Pfizer had over 30,000, 44,000 people enrolled in the trials, and the trials are ongoing. So that gives you a sense of the magnitude we're talking here. Lots and lots of data collection and good evidence generation. So I'm going to talk to you as well about when and how you will be able to be immunized against COVID in Peterborough. I can touch on that briefly now to say we don't currently have any vaccine. We are expecting vaccine in early February. It will be the Pfizer, so that's the one that's coming to Peterborough at least that's what we've been told. And we will be going into the long-term care homes to immunize long-term care home residents, staff, and essential caregivers first. They will be at the top of our list. And as Brittany has said, I will answer the questions that were sent in, and if there's time, we'll get to your additional questions. So I have about 40 slides, just so you know, and we'll hopefully, as I said, if there's still a question that is outstanding by the time we get to the end of these, I'm hoping I can answer that either today or very soon. Next slide, please, Brittany. So let's start with those, the limits of our knowledge. What do we know and what do we not know yet about these messenger RNA vaccines? Next slide, please. First of all, we are still learning about our immune responses with COVID-19. What parts of our immune systems are being triggered, what parts of our immune responses are important to prevent us from being infected, which parts of the immune system actually prevent us from getting severe disease, and potentially which parts of our immune system can play a role in preventing the transmission of the virus to others. We still don't know this yet. Next slide. We also don't know how long these vaccines will work and whether they will wane over time. Will we need to boost these vaccines? Will they need to be changed because of the virus changing. As you know, right now with influenza, because the influenza virus is constantly mutating, we're getting different variants of the influenza virus emerging, which means that we have to do a new vaccine each year. The current clinical trials will go for 2 years, and we will learn some of this with time as those clinical trials progress and then are completed. Next slide, please. We also need to understand better whether the immune system will behave differently depending on whether we've used a vaccine to trigger it against COVID, or whether someone acquires natural infection, someone who has had COVID-19 and has been ill. How differently will our immune systems work? So that's another piece where we just don't have the answer yet. Next slide, please. We still also don't understand how different people will respond. The clinical trials to date have not included children. They have not included pregnant women or people who are immunosuppressed. Some of those studies have been started, but they have yet to be completed. So there are still some gaps where we just don't have data. Next slide, please. We also, the thing about coronaviruses, so COVID-19 is a coronavirus, but so is MERS-CoV and SARS. Those are very, very deadly diseases that aren't very contagious, but still, just to give you a sense, we also have 4 coronaviruses that are actually very common and cause symptoms that are similar to the common cold. And so we have this spectrum in coronaviruses, and we still don't know yet whether people who've been infected with one of these other coronaviruses will have a different immune response to the vaccine that's protecting us against COVID-19. Next slide, please. So that said, now I want to focus on what we do know about COVID-19. And as I've said on this cover slide, we're learning more every day. Our knowledge is increasing every day. So for today, I'll share with you what we currently know about these mRNA vaccines. Next slide, please. So first of all, let's talk about the how they work. Here you see a photograph of a burglar. Okay, this is a burglar breaking into your house, and they're grabbing the doorknob. Okay, I think it's a good analogy for how coronaviruses enter your cells. So the coronavirus has this spike protein on its surface, and that spike protein is what attaches to your body's cell, the cells of the respiratory tract. And that's how that virus unlocks the door. It creates an entry point for the virus to enter into your cells, just like that burglar is grabbing that doorknob and coming into your home, or they have a crowbar and they're ready to use that to break into your home. That's how that coronavirus is breaking into your cell, by using that spike protein. So what the vaccine does is it helps our immune system recognize that spike protein. It's like putting a camera on your front door, so that if the virus is detected, the immune system can respond quickly and effectively to prevent that virus from even knocking on the door. That's how it works. Next slide, please. But I want to warn you that even though the vaccine is putting a camera on your front door, it isn't a magic wand. It's not a magic bullet. If you are already infected with COVID-19 when you are being immunized, let's say you are incubating it, it won't stop you from getting COVID-19. So it's important to know that if if you get COVID-19 in the first few days after you've been immunized, you didn't get it from the vaccine. You got it from somewhere else, from someone else. If you are infected before your body's immune system is fully armed, you can still get sick with COVID-19. And even if the vaccine is working as it's intended to work and your immune system is now fully armed and activated, the vaccine is not 100% effective. Nothing ever really is 100% effective. And that's important to know. But the good news is that the vaccine can help prevent you from getting a severe case of COVID-19. So it may not be 100%, but it should protect you. Next slide, please. So can I get COVID from an mRNA virus? You can't. The vaccine does virus. It takes about 14 days for your body to be fully armed and activated, so the protection is not optimal for 2 weeks until the second dose. That's really when you know that it's up and working as well as it can, 2 weeks after the second dose. Next slide, please. What is messenger RNA and how does it work? So we all have messenger RNA in our bodies. It's in our cells and it is usually very busy. It travels back and forth from the nucleus of the cell to the ribosomes. And these ribosomes, they're sort of like the factories in the cell. That's where all the different proteins that your body needs are produced in those ribosomes. Next slide, please. How does it work? Well, the vaccine, you see the top here, the vaccine introduces the mRNA into the arms, into your arm and into the cells of your muscle, the deltoid muscle. And it carries that genetic material, that RNA into those muscle cells. And what it does is then your body uses that messenger RNA to manufacture a version of just that spike protein that's found on the surface of the COVID-19 virus. So your cell turns on your cell's factories to make the spike protein. Next slide, please. And then what happens is that spike protein sort of floats to the surface of your muscle cells where your immune system gets triggered. So your immune system is triggered to then manufacture all of the components of the immune system to respond to the virus in a variety of ways. And so then your immune system becomes activated to react, so that if you are exposed to the virus in the future, your immune system is now armed and ready to recognize it ideally before it even infects your cells, and definitely before it starts to make you sick. So you may never even feel sick. You may not even know that you've been infected. Next slide, please. The benefit of getting vaccinated is that because the virus replicates so quickly, it gives you a head start. It gives your body a head start to identify the virus and to remove the virus, get rid of it before it has entered your cells and before it can replicate to a level beyond what your immune system can handle all at once. Next slide, please. Does the mRNA in the vaccine pose any risks to my DNA? Well, the answer is no. Your DNA is your genetic code for all the different proteins that keep your body running, and that code, that master recipe book, is very precious, and it's locked inside the nucleus of your cell. So this vaccine does not enter the nucleus of your cell. It does not interact with your DNA. It goes straight to the factory, or if you like, maybe the kitchen, where the cell's ribosomes, where it provides the instructions or the recipe for your ribosomes to make the spike protein. So they don't change your DNA. They don't go anywhere near it. Human beings actually don't have the enzymes that convert RNA into DNA. In fact, our cells have enzymes in them that destroy messenger RNA after the protein is made, which is why the vaccine actually doesn't even stay in your body for very long. Next slide, please. How long do those spike proteins stay? Well, both the vaccine mRNA and the spike protein that your cells create and that are on the surface of your muscle cells are cleared very quickly, either by the enzymes or by your immune system. So this takes usually anywhere from a few hours to a few days, which explains why after you get the vaccine, your arm will be a little sore for 1 to maybe 3 days, and that's because of the presence of that spike protein on those muscle cells and the fact that your immune system is clearing it. Next slide, please. How safe is the Moderna? So I'm going to break the two vaccines down. I'll start with the Moderna vaccine, and the most frequently reported adverse reactions after either the first or the second dose of the Moderna were pain. 92% of people had pain at the injection site. 70% had some fatigue. Almost 65% complained of a bit of a headache. 61% had some muscle ache, and 45% had some chills. So important to know that there is a high likelihood you're going to get some transient side effects. The majority of these local and systemic reactions had a median duration of about 1 to 3 days. But again, I just want to emphasize that these are all signs that the immune system is being activated. They actually are telling you, yes, your body is responding to the vaccine. Next slide, please. What about the Pfizer vaccine? And that's the one we're getting here in Peterborough. Yes, it has the same side effects. Again, the most common symptoms are sore arm, fatigue, headache, muscle and joint aches. Just important to know that fever is not a common side effect. Only 14% had fever. So if you are ill after you've had your immunization with a fever and any other signs of COVID, please get a medical assessment and potentially get tested for COVID because you may have been incubating it. Symptoms of the vaccine last about 1 to 3 days. They're more common with the second dose because now you've got a bit of immune system already activated there. And good news, they get milder the older we get. And again, because your immune system isn't as robust as we get older, your side effects also aren't as bad. So maybe the one good thing about getting old. Next slide, please. Who shouldn't get the COVID-19 vaccine? Well, right now, there are people for whom we have no data. Children, pregnant, and breastfeeding women, and I'm going to come back to that in just a moment. But anyone who's had an anaphylactic, severe allergy reaction to any of the vaccine ingredients, and I do have a slide and I will list those, is recommended not to get the, actually you cannot be immunized. The most common one is polyethylene glycol or PEG, and you might be thinking, oh my goodness, how do I know? Well, PEG is a common laxative. If you've used Restoralax, or you can actually buy PEG at the pharmacy. Sometimes it's used as bowel prep before you get a colonoscopy and if you've had a serious reaction to that, well then you are not a candidate for this vaccine because it is in the vaccine. Anyone who is acutely sick at the time should not be immunized. So if you're sick, you may have to reschedule. As I said, it's uncertain benefit in people who are immunocompromised. Again, we just don't have data yet, and it should be given with caution to people who have bleeding disorders like hemophilia, or for people who are on anticoagulant therapy. You can still give it. Important for the immunizer to know, and you should make sure that your INR is normal for what you need to have it for therapeutic reasons. And then typically we use a smaller needle. We put more pressure on the site to ensure that you don't have lower risk of bleeding from the injection. Next slide, please. So I'm going to talk a little bit now about the safety. For the Moderna vaccine, the safety analysis was done on over 30,000 people. Half of them got the vaccine and half of them were given a placebo, and they didn't know. So they were blinded and to whether they got real vaccine or placebo. These people were then followed for up to 63 days after the second injection. So that's 2 months. What they saw was that side effects were less in older recipients, more common after the second dose. And in that group of 30,000, especially those 15,000 that had the vaccine, there were 3 serious, what were called serious adverse events. There were 2 cases of facial swelling that occurred within 7 days after the second dose. There was 1 person who had quite severe nausea, vomiting, and hypotension, low blood pressure and fever. They required hospital treatment, but that person had a history of hospitalization in the past. So that was the Moderna trial. Could I have the next slide, please? In the Pfizer trial, for their safety analysis, they actually studied their 44,000 people in the trial. Half got vaccine, half got placebo. They were followed for 2 months after the first injection only for the safety analysis. So they looked at 19,000 people who had vaccine. Similar symptoms were seen with the Moderna vaccine. They were reduced again in older people, seemed to be more common after the second dose. And what they found is that for people aged 16 to 55 years of age, there was that 0.4%, under 1% of them had what they were classified as a serious reaction. For recipients 56 years of age and older, they had double that, 0.8%, but still less than 1%. And that's what is reported in the product monograph. Next slide, please. So there is, I mean, as I said, we have, these trials are larger than usual, but they are still relatively small compared to how many people will end up getting this vaccine. So much of what we will learn about the safety profile of these vaccines will be done through what we call post-marketing surveillance. So here in Ontario, we have the Health Protection and Promotion Act obligates anyone who immunizes a health professional, a regulated health professional, they must report whether there is an adverse event. This is what the form looks like. I know it's too small for you to read, so you don't need to read it, but just to make you aware, there are forms that have been created by Public Health Ontario. Any reported as the medical officer of health, I investigate all adverse events reported in Peterborough. We report to Public Health Ontario once we've investigated. So that all gets assessed and analyzed. In addition, in Canada, we have special immunization clinics. They've been set up mostly for the pediatric population because usually it's children getting the brunt of immunizations, and these clinics will see anyone who has had potentially a serious side effect. We are looking at the federal and provincial governments are looking at expanding these special immunized clinics so that adults who have had a serious event following the COVID vaccine can be assessed. In addition, there is going to be a volunteer surveillance program set up. It's called Canvas, and they are looking to recruit 50,000 people per vaccine per province. And people at the time of registration, when you're signing up to go and have your vaccine, you can be expected to be asked if you would like to be part of this volunteer surveillance. If so, you're given an online survey to complete 8 days following your first dose, 8 days following the second dose, and then 6 months after the second dose. And in addition to that, there is telephone follow-up if you do require any medical observation or assessment for up to 72 hours after each event. So that volunteer surveillance program will also be up and running by the time most of you are immunized. Next slide, please. So let's get into a little more of the details about pregnancy. If you are a healthcare worker, you're a nurse or a physician, a respiratory technician in the ICU, and you are pregnant, we can offer, the vaccine can be offered to you if you've been counseled by your treating provider on the risks and benefits, the potential risks of COVID infection during pregnancy, especially if you are in a high risk occupation, and provided that the client recognizes the fact that we just don't have much data at this point. So there is a potential for healthcare workers who are pregnant to get the vaccine if that is their choice after they have sought the advice of their provider. Next slide, please. For breastfeeding healthcare workers, because mRNA vaccines are not live vaccines and based on their biological mechanism of action, we don't expect them to be feeding infants, and so we are providing them to breastfeeding healthcare workers as long as they recognize that there currently is no data or not enough data for people who are breastfeeding at the time of receipt of these vaccines. So that they are available to breastfeeding healthcare workers if requested. Next slide, please. What about the general public, though? So definitely if you are not in a position where you're being exposed to COVID and so your risk for acquisition is lower, our advice is that if you are pregnant, breastfeeding, or planning to have a baby, talk to your healthcare provider to see whether or not there's any reason for you to get the vaccine. But usually, as a precaution, we are going to say you should avoid trying to get pregnant for 1 to 2 months after finishing the second dose of your vaccine. That's going to be the advice we give most people, members of the general public. Next slide, please. So what if you are currently autoimmune? You have an autoimmune condition, you're compromised, maybe because of an illness or because of a treatment that you're taking that actually suppresses your immune system. Right now, the guidance from the province is that the majority of people in these groups can be offered the vaccine, provided that they recognize that there just isn't evidence of how effective the vaccine is in these groups, and that it's possible that the vaccine may not be fully protective for them. For people who are on, I have a list on this slide in small print, but your doctors have this guidance. If you're on one of these immunosuppressive therapies, we are asking that physicians who are treating you, who are prescribing these drugs to you, have a conversation with you and determine whether or not it's worthwhile for you to be immunized. So you may need to have a conversation with your healthcare provider before you know for certain whether you can or should get the vaccine. Next slide, please. What about people who have severe allergies? Well, anyone who has a severe allergic reaction or anaphylaxis to other vaccines or injectable therapies must be evaluated by an allergist or an immunologist before you can get the vaccine. And you will need documentation. There is a form that needs to be completed to confirm that this person, this specialist, has actually recommended you to be immunized. We're also advising that anyone who has a history of severe allergic reactions to things like food or pets or insects, that you can be offered the vaccine, but that we are going to recommend that you remain in observation for a period of 30 minutes. So you can have it, we want to keep you longer, and if you're not completely well at 30 minutes, we may keep you even longer than that. Just be aware of that. Next slide, please. So I share with you that last Friday, actually day, the CDC published its review of the first 1.9 million people in the US who had been given the vaccine. It still needs to be peer reviewed, but what they found was that 2% of people reported some kind of an adverse reaction, and most were very mild. There were 175 people where the reaction was strong enough and potentially could have been represented a severe allergic reaction. These people were investigated, and of those people, 21 were determined to actually have had an anaphylaxis reaction to the vaccine. So that's right now it's looking like the risk for anaphylaxis is about 11 people per million doses administered. What's interesting to note is that 90% of these 21 people were females. So there seems to be a higher risk in females than males. And when you looked at their history, 4 out of 5 had a documented history of allergies to drugs, medication, insect stings, or food. So the important news, I think, take-home message is that we will be looking for this as a history as part of the consent process for vaccination. What they found is that the median interval to this reaction was 13 minutes. So people tended to react quickly. So again, we are planning to keep these people. If we know there is a documented history, they will be kept for 30 minutes as a precaution. And the good news is that there were no deaths. So I think we can prepare for this very low risk of this occurring, and we will be prepared in our clinics. In fact, all of our nurses have CPR training. They are all training on, they all know how to respond to anaphylaxis. They know how to use epinephrine. There will be epinephrine in all of our sites where we are immunizing. So we are prepared for the very, very low likelihood of an anaphylactic reaction. Next slide, please. Okay, so we're going to now move into the questions. So let's go. Let's see. What's the first question? What is the vaccine rollout plan for Ontario? Well, there are 3 phases to the plan so far. In phase 1, we are going to be prioritizing the resident staff and essential caregivers in our senior congregate living centers, starting with long-term care homes, but going on to do the retirement homes, and then the congregate living centers that are not unlicensed retirement settings. We are also prioritizing healthcare workers, starting with the hospital healthcare workers. First Nations, Métis, and Inuit populations are going to be also in that first group. And then the adult recipients who are on chronic home care will also be in that phase 1. We are hoping to receive vaccine in the first week of February, and the PRHC has the ultra cold freezer that will store the Pfizer vaccine for us. Phase 2 begins as we get more vaccine coming online and being delivered to provinces. We will begin phase 2 potential, and this will be anytime between March and April, going to July, and that's when older adults starting at 80 years and over in the community will be offered vaccination, and we will proceed down in 5-year increments. So then it'll be the 75 years and over, 70 and over, until we've completed all of our older adults. We will also prioritize the residents or staff of high risk congregate care settings. We will also do our frontline essential workers, like our first responders, educators, teachers, people involved in critical industries that need to keep supplying us during the pandemic. And we will also do other populations that are higher risk because of barriers or inequities that we've identified. Next slide, please. What is the vaccine rollout plan? So when can the general public expect the vaccine? As I said earlier, we are hoping to do long-term care residents. We must complete our long-term care homes by February 15th. Because they have been prioritized by the province. We will hope to move into phase 2 in March and April and complete phase 2 by July. And we anticipate being able to start our mass immunizations in the community by May. And we hope that by the end of the summer, end of August, we will have lots of vaccine available, including hopefully in your doctors or nurse practitioner offices. Next slide, please. How will vaccine clinic information be communicated? Well, we are definitely committed to keeping everyone up to date. We currently have a web page where we are putting all of our information. We will, for specific populations that are to be vaccinated, you will be contacted directly or through your employer. And then when the mass immunization clinics begin, we will have information in our web page. We'll use our social media platforms. We will communicate with the media, and then we will also advertise as needed. I don't think you should have any trouble learning when you will be able to access the vaccine here in Peterborough. Next slide, please. Can I still get the vaccines if I have existing health conditions? And the answer is yes. People with stable health conditions, including HIV, may be vaccinated with the vaccine as long as they're not on medications that weaken the immune system, and that includes people with stable hepatitis B or C as well. Next slide, please. How effective is the vaccine? Well, both of the mRNA vaccines were compared to people who received a placebo, and in both trials, at the time of publication of the results, there was at least 2 months of follow-up after the second dose. For the Moderna vaccine, there were 11 cases of COVID in the vaccine group and 185 cases in the placebo groups. That works out to an efficacy of about 94%. When they did a sub-analysis of people 65 years of age or over, that efficacy was about 86%. And it's important to note that whether or not they got COVID, people who had vaccine did not get severe illness, and none of them were hospitalized. So there seems to be a benefit, even if it's not completely effective. For the Pfizer vaccine, there were 8 cases in the group that got the vaccine, and there were 162 cases reported in the placebo group. That works out to an efficacy of about 95%. And the good news is that for Pfizer, people 65 years of age or over still had really high protection, very close to 95%. So there seems to be a little better protection in the Pfizer vaccine for the older participants. And again, this is the one that we are taking out into the long-term care homes in February. Next slide, please. What's in the vaccine? Well, first of all, for those of you who have latex allergies, there is no latex in the Pfizer vaccine. In red, I've identified again that there is the polyethylene glycol, the PEG, which is the laxative, the Restoralax. It's not in the vaccine as a laxative, but there's a small amount there. So if you are allergic to it, you cannot have this vaccine. But then there's a variety of lipids, phospholipids, cholesterol, and they're just fats. They're so nothing harmful there. There's some acetic acid, which is vinegar. Sodium acetate is a salt. Sucrose is a sugar. Tromethamine is a buffer that's used to try and balance out the acidity, alkalinity of it's actually just a stabilizer for the vaccine, and there's water. Next slide, please. How long can I go before the second dose? Well, for the Pfizer, what's recommended is 3 weeks. For the Moderna, it's 4 weeks, but the Pfizer in the trials could be given 4 weeks apart as well. Just on Tuesday, a few days ago, our Canadian National Advisory Committee on Immunization released a statement which they reviewed all of the data from the trials, and their recommendation is that no longer than 6 weeks between doses. So once you get your first dose, you shouldn't really wait more than 6 weeks to get your second dose. I know what some provinces are trying to do, like Quebec, is they're trying to get as many people immunized with their first dose because you do get some protection with the first dose. Well, we just don't want to jeopardize the effect of the vaccine, and there just isn't data right now about what happens to people who only get 1 dose. So NACI is recommending that 2 doses be given, but that if you really have a crunch and you can't get back to people in 3 weeks, that you can go as long as 6 weeks before getting that second dose. Next slide, please. If I had COVID and I'm better, do I still need the vaccine? Yes, you do. And there is some evidence to suggest that natural immunity from COVID-19 may not last very long. We now have people getting reinfected with COVID-19. So because of that, we are recommending that even though you had COVID, you should still get the vaccine to ensure that you have the best protection on board. Next slide, please. Do I still need to wear a mask and avoid close contact with others if I've received 2 doses of the vaccine? And yes, you do. It is important for everyone to continue with all of the public health measures, like wearing a mask, physical distancing, washing hands, until we reach herd immunity. Once we get herd immunity, we have enough people in the community so that the virus actually disappears and stops circulating, then at that point, we probably can start to relax our measures and go back to life as we knew it before. But up until then, we will be expecting people to continue with the public health measures that are currently recommended. And we will advise when in fact you can stop or ease back on some of those. Next slide, please. Will the vaccine protect me against the variants? So there's been a lot of news recently about the UK variant, the South African variant, and that's because viruses are constantly mutating, and it's very normal, and we know that from influenza. We see this every year, so the UK and the South African variants that have been in the news have had some genetic changes in the spike protein, which is why people are concerned. And that's because the vaccines work by recognizing getting your body's immune system to recognize that spike protein. So theoretically, you know, if the spike protein changes, will your immune system still work? So Pfizer and Moderna, so going forward, Pfizer and Moderna are able to genetically sequence the virus in any of the study participants who are diagnosed with COVID-19. So we know that there will be a close examination of the of potentially people getting ill with variants going forward. But just last week on Friday, I believe, Pfizer did release a study where what they did is they took blood samples from people who had been immunized in their study, and they injected them with these new variant viruses. This was a study that was done in the lab, and they did it on 20 samples. And what they found was that all of the immune components were still triggered, and they were able to neutralize these viruses, even though it was a variant. So the emerging evidence is that the vaccines are effective. However, Pfizer has also said that should a variant arise that is not covered by the current vaccine, they can produce a new mRNA vaccine in about 6 weeks if they needed to. So that's one of the other real benefits of this new technology using messenger RNA rather than having to grow viruses in chicken eggs, which is how we currently make most of the influenza vaccines. We just can do it a lot quicker than we have had in the past. Next slide, please. Why should I get the COVID-19 vaccine? Well, that's what this is all about, really, is providing you with the information that you need in order to make an informed decision. And it really is your decision. The vaccine is completely voluntary. You have to make the best choice for yourself. But reasons why the vaccine, it is really the best level of protection that we would have. And any of you who remember polio and remember the last polio epidemic here in Peterborough in the 1950s will remember the difference that having a vaccine against polio made. It completely eliminated polio and protected the generations of children to come. So vaccines are really the most powerful healthcare intervention that we have to offer. They're the biggest tool in the toolbox. If the vaccine will help keep you safe, it can help protect your friends, your family. It helps, once we get herd immunity, it protects everybody in the community, even those who aren't immunized, like our children. They will get protection if all the adults are immunized. We know now that even children tend to be infected by their parents and other adults rather than each other. Getting the vaccine will ensure that you will remain in the workforce. So if you're an essential worker, or if you really need to work because you need to pay the rent, getting the vaccine will help ensure that you stay in the workforce. And it's important to get the vaccine to help you avoid getting COVID, because as you know, we have the long haulers. We have people who've been ill with COVID and who continue to have symptoms months later. We don't know how long those people will continue to be to have symptoms, and we certainly know we've had people who've been intubated and in ICUs for months, and so the COVID-19 vaccine will help prevent those severe complications. Next slide, please. Aha, so now we are at the point in the presentation where I do have some time and I can take some of the questions that have been put into the chat box. So Brittany, go over to you. Are there any questions I can help answer?
I am happy to read off your questions, and maybe you could turn on your camera and we can spotlight you while you do this. Let me just get that going. We did receive some really great questions. There she is. The first that came up was a clinical question understanding what the term INR means when you refer to that.
Anyone who is getting Coumadin or one of the anticoagulants will know that that's the test that's done to make sure you are anticoagulated, and it is a blood test. And depending on which drug you're on and how stable you are, you have to have this blood test done on a routine basis. So that's why I mentioned it. So if you are anticoagulated, you're taking an anticoagulant, and you're getting your INRs done, you want to make sure that you are in the therapeutic range and that you haven't strayed above your range, because that would put you at greater risk of bleeding if you've got a poke in your arm.
Okay, thank you. The next question we have is from Lucy. She's asking, when will Peterborough receive the freezers to store the vaccine?
So we have, PRHC has the ultra cold freezer, and in fact, they're getting a second freezer as backup in case something goes wrong with the first freezer. We also know that some of our other partners in the community have ultra cold freezers. There's 3 or 4 of them in the community. We know where they are, and we could potentially use them if we needed to. Here at Peterborough Public Health, we're getting a Moderna Freezer, which is -20, and I'm not sure when it will be arriving, but we have been told to make room for it. We're prepared to for that. We will have it set up and inspected so that if we get Moderna vaccine, we can store it here at Peterborough Public Health.
Okay, great, thank you. We've got lots of Trent students on the line, which is wonderful. And one, Kira Parr is asking, as a student at Trent currently living in Peterborough, but from the Mississauga area, and she often goes back there to live during the summers, am I required to only get the vaccine in a certain city based on postal code?
No, I don't. I don't think that's going to be an issue. So far, as I said, the first thing we're going to do is we'll do it by age. So people will have to probably show proof of age. But I have heard no indication that it's going to be limited by address. It will probably be where it's most convenient.
Okay, great. Thank you for clarifying that. Our next question comes from Barry Walsh, and he is asking, with the need for second dose within 21 days for the Pfizer vaccine, may some people get the second dose of the vaccine before others get their first dose?
That is happening right now, Barry. So there are, and as we roll out the vaccine, that's part of the planning, and it is that recognition that once you're 3 weeks into your vaccine rollout, you will need to be doing those second doses, and so there will be weeks where in fact you're doing more second doses than first doses, depending on the supply. All of this is so contingent on how much vaccine you have. If you've got lots of vaccine, you can still keep doing lots of first doses, but because of the need for that second dose, if you have scarcity of vaccine, then that is going to influence who is getting their dose, whether it's first timers or whether it's people coming back for their second.
Okay, great, thank you. So Jacob Van Haften is asking, are there any volunteer positions for citizens interested in participating in the vaccination process?
Yes, we're going to need I don't think, I mean, right now we're still months away from the mass immunization clinics, but I think we will have a need, even if it's like directing traffic and, you know, getting people registered, getting them to the right place. We need runners, people who are going to take the vaccine in the syringes, the drawn up, the prepared syringes to the immunizers when they need more vaccine. So we will be setting up opportunities. In fact, we do have a volunteer form right now. Brittany, is it on the vaccine webpage, or where can people find that?
They'll find it on our careers page, actually. So just go to that part of our website and there's a form people can fill in with their information.
Great, thank you. And the thing is, right now, we're so focused on the long-term care homes that we may not be able to get back to you for a while. But I mean, I do have the city and county emergency coordinators. They're actually working on those mass immunization plans, and they're looking at venues and finalizing venues. So even though we may not be able to get back to you right now as a volunteer, we will. And this is going to be a community effort. We're going to do this together.
It's been wonderful to see the uptake, and our colleague Sarah Gill has put in the link to the volunteer sign up form in the chat box, but you can also find it on our website. Okay, our next question is from Natasha Antonoff. She's asking, could the Trent University Emergency First Response Team qualify for vaccination in phase 1 as they provide emergency medical care to the students at Trent University, or would they be counted in phase 2 as first responders?
No, the first responders in phase 2 are mostly the police and enforcement first responders. I anticipate that paramedics, firefighters who respond to 911, and potentially your first responders who are medically responding, that they would be included in phase 1 as healthcare workers. So as I said, healthcare workers will be done in phase 1. We're starting with the hospital, like ICU, Emerge, because they are working with high-risk populations and are actually at high risk themselves. But we are going to move, once the hospital is done, we're going to move to community healthcare workers, and we anticipate that they would be next. So stay tuned, but that's where you would fall, would be phase 1.
Okay. Thank you. So Dr. Salvatierra, we are at our time, but we have about 5 or 6 questions left. Do you have a bit more time to carry on?
Hang on, let me check when I have to be at my next meeting. Yes, I have a few minutes left, so let's keep going.
We will do it. And for those that we don't get to in the, please put your questions in the chat box and we'll be sure to answer them on our FAQ. Okay, Donna Lockhart is asking, is it likely or being discussed to use our pharmacies to deliver vaccines?
Yes, in fact, just this week, the province amended the regulated health professionals legislation to add COVID-19 vaccination to the scope of both nurses and pharmacists who are working with public health in the delivery of the vaccination. So I do expect that we will have pharmacists involved, as well as nurses and physicians doing the immunizations. We just don't know when yet, but yes, they will be part of the response. And in addition, at some point, the province might actually decide to use pharmacists the way they are currently being used with flu immunization, where you can go to the pharmacy and get your vaccine there. I don't know if there's been a decision made yet. It hasn't been communicated to us, but that is also a possible scenario.
Okay, thank you. Next question comes from Amber. Are employees in group homes considered to be in the second phase?
I think so. I think so, but I'll know better once we get a closer look at that, at the healthcare worker scenario, because I know healthcare workers in congregate settings are covered in phase 1. So if you're like a physiotherapist in a group home or a nurse, you are covered in phase 1, but I think the remainder of the other staff are considered essential staff, and they would be done in phase 2.
Okay, great. This next question comes from Sharon Ritchie. How do my aunt and uncle, they're over the age of 80 with COPD and asthma, get the vaccine as they live in a Peterborough condo in the second phase, but doctor won't have, so where do they go?
So if your uncle and aunt are currently receiving home care services, if they have and not, by that I don't mean a PSW, I mean if they have a nurse, if they're sick enough to need a nurse that's coming in to help them and assess them, they will get it in phase 1. We still haven't heard how yet. I have asked that question, and I was promised that they would get back to me, but people are so busy. So I'm expecting an answer at some point. They will be done in phase 1. If they are independent and not on home care and in the community, they are asked to continue to be very careful to self-isolate at their in-home, and they will be done as part of phase 2. We will be doing adults by age, starting with the older adults in phase 2. So that's anywhere in April, hopefully. Again, the sooner we get vaccine, the sooner we can move up the phases. But right now, the province is anticipating that it'll be April, May.
Okay, thank you. And I'll rely on you, Dr. Salvatierra, to let me know when you need to sign off. We do have one more question from Marilyn. If you are an essential worker, will you need some type of proof? What should you have for this proof?
So when you are immunized, you will get a receipt. And what we're going to recommend is that you actually have it emailed to you. You can get a printed copy at the clinic where you get your immunization, but you can also ask that it be emailed to you, which is the preferred method. And you should do that. It'll be emailed to you, and then you have a copy of that. And if your employer needs it or wants it, or if you're traveling, you can use that as documentation that you have been immunized.
Okay, great, thank you. Ken Seam is asking, when would you anticipate that the 65 to 70 age group will be vaccinated? In May, this age group was considered in the high risk category.
They are in the high risk. They're the highest. I mean, well, 60 to 65. They are in a higher risk group. It gets worse. The older you get, the higher that risk. Over 80s, you are at the highest risk. So if you're over 80 and you're listening today, you will be the first group when we go out to the community, will be 80 and over. I can't predict when we'll get to the 60 to 65s. They will be towards the end of that age delivery. There are 3.5 million people that we have to do as part of those age groups. It is anticipated that, April, May, June, July, that's when we are going to do the bulk of the immunization. And by then, it'll be warm enough that hopefully we can even do it through drive-throughs, because I know how popular the drive-through method is.
Great, thank you. Ron Carbeth is asking, what if your health card is outdated and you can't renew it?
Don't know. Should be okay, but bring what you have.
We'll get more of those details. And the next question comes from.
But may I say that if you still have a red and white health card, you must be an antique collector, and you can keep it if you want it, but you shouldn't be using it. Those expired long ago, and they are very hard for us. If you still have a red and white and you get a COVID test result, we can't do you online. So please get your cards up to date and use the green ones, because those are the ones that help us do the COVID testing, and those results go online and your doctor gets them. And we can get them for you. So I just had to put that plug in, because there are some people hanging on to those red and white. I loved my red and white card, but I had to give it up at some point.
Yeah. I think Service Ontario might be able to help those people without an updated health card as well. This next question comes from Kathy Carrington. My husband is a non-healthcare essential service worker. When and where will the vaccine be available for him?
So that will be in phase 2, and we still we're not there yet as far as what those clinics are going to look like and where they're going to be, but we just know that for certain Ontario has 1.5 million essential workers, and I would include teachers in that group, and they will be done as part of phase 2.
Julie Found is asking, what if you do not have a doctor? How will citizens be called for their vaccinations?
You'll get the information from us directly. Again, social media, on our webpage, you will use every channel that we can to get the word out.
Please follow us on social media. That's where we will be publicizing the
Yes.
information about
Good reason. Another good reason to follow us on social media.
Thank you. Okay, Lori Schuett, how will phase 2 recipients be informed about getting their vaccine? Email, phone call? Where will phase 2 people get their vaccines, and which vaccine will phase 2 people get in Ptbohealth?
So I can't answer the last one. We are hoping that by phase 2, any vaccines, I know the federal government has agreements to purchase 7 different kinds of vaccines in total. So a lot of it will depend on what kind of vaccine we have. If we get the refrigerated vaccine, for example, it's more likely we can provide it to family doctors and other primary care providers and pharmacists, so we can get it out, and you might be able just to go there to get it. But we are planning, in the meantime, we are planning mass immunization clinics. They will be well advertised. Again, if you follow us, if you are on social media, you will know, and you will have to book your appointment. So this is the difference. If you remember H1N1, we had people line up. There won't be, because of public health measures and the need to physically distance, we will not have lineups this time. You will be given an appointment. So similar to people, if you're going for testing at the Northcrest Arena, it'll probably be a very similar process where you have to go online and book your appointment. During that registration, you will be asked several questions so that we can make sure that it's the safest place for you to go, because as I said, some kinds of allergies do you in the mass immunization clinics. You'll be referred elsewhere. There will be a consent process. You won't be given an appointment until you consent, which means you have to understand the vaccine. So this kind of a session is really good, because then you know you can make an informed consent. And then when you'll be given an appointment, you'll be told when to arrive. When you do arrive, you will be your consent will be validated. You'll be just confirming that you've consented, and then you will be immunized. There should not be much of a wait. You should be in and out pretty quickly, unless you have a reason to stay later. As I said, if you've got allergies, a history of allergies will keep you longer, at least 30 minutes rather than the 15 minutes.
Okay, thank you. Next question comes from Judy Brocklehurst. Will our doctor's office be contacting us with appointment dates when it's our turn for to receive the vaccine? So
potentially, because if we get vaccine to physicians, they have electronic medical records. Many of them use email. They may just, do a direct communication with their patients and book their patients in to get immunization. So there's still a lot that we just don't know at this point yet. I'm going to try. I think, Brittany, I need to wrap it up maybe in another minute or so.
Okay, good stuff. We're getting towards the end. Elizabeth Wright is asking, are the 2 doses the same?
It cut out there. I did.
Sorry, can you hear me? So the question is, are the 2 doses of the vaccine the same?
Yes, they're the same amount each time, but we're not interchanging them. So if you get Pfizer on first dose, you need to get Pfizer on your second dose. We're not going to give you Pfizer one time and Moderna the next time.
Okay, thank you. And also to clarify an earlier question about proof if you're an essential worker, I think some people were interpreting that as, do you need to prove you're an essential worker, as opposed to do you get proof of vaccination?
Well, if you're an essential worker, we'll probably work through your employer. So it won't be that you have to show up and give proof. We will ask your employer to help us get you registered for a vaccine.
Okay, let's go with one more question then. So Claude is asking, just to clarify, I'm a hemophiliac and there is no additional risk to bleeding with this vaccine than any other vaccination.
no other vaccination. So for you, we would definitely try and use a smaller gauge needle, and we would want to put some pressure and watch you for a little longer to make sure you're not bleeding. So there is always an increased risk of bleeding, of course, but we will do our best to try to reduce that risk.
Okay, thank you. Thank you so much for your time today, Dr. Salvatore, and thank you for the great questions from our residents. Sorry we couldn't get through them all, but we will add them to our FAQs, and yes, this information will be available. So thank you very much, Dr. Salvatore, and appreciate everyone's interest. Please follow us on social media, and we look forward to keeping you informed as we go along here. Thanks so much now.